Hi, I'm Allie Griffin, and I'm a student nurse here at Methodist, and I'm here today to talk to you about breastfeeding. I'm sure as new moms, you have plenty of questions about what is great for baby and what's not so great for baby. Well, breastfeeding is awesome. Breastfeeding is the optimal method of infant feeding, and it can be a special experience for you and your baby for many, many reasons. And these reasons include it is a joyful bonding with your baby. It's the perfect nutrition that only you can provide. The cost savings are huge, and then there's tremendous health benefits for mom and baby. I'm going to expand more now on the benefits that it provides for you and baby. So the baby benefits are amazing. Breast milk is liquid gold. It is colostrum, which is like the thick yellow breast milk that is first produced throughout pregnancy and right after birth. And it contains many, many nutrients and antibodies that protect your baby. The next benefit is that your breast milk changes as your baby grows, which formula does not. Colostrum changes into mature milk, and this happens around the 3rd or 5th week, and this mature milk has the right amount of fats, sugar, water, and proteins that can help your baby. And then breast milk is easier for the infant to digest, whereas formula milk is cow milk and it has cow proteins in it, and that's harder for the baby's digestive tract to break down, and it takes longer for the baby to adjust to this formula. And then lastly is breast milk fights diseases, which is a benefit that formula cannot provide. And it reduces necrotizing enterocolitis, which is a disease that affects babies' gastrointestinal tract. It can also reduce risk for asthma, type 2 diabetes, childhood leukemia, and SIDS. So now I'm going to talk about what benefits are for you. The first benefit is it makes your life easier. Whereas in the beginning it may be a little more difficult to breastfeed, but after you and your baby settle into a routine, it is so much simpler. You don't have to go buy bottles, you don't have to go buy nipples, you don't have to sterilize the bottles, and you don't have to sterilize the nipples. You don't have to mix and make formula. Your breast milk is already there. Also, it saves money. So it has been said that formula feeding costs over $1,500 over the span that the infant eats the formula. And whereas your breast milk is free, you produce it right then and there. Another benefit is breastfeeding can feel great. It promotes physical contact, which newborns need to make them feel safe and secure. And then with this physical contact, it's usually skin to skin, which promotes oxytocin production, which is a hormone that makes mom feel good and also stimulates milk flow. Next, breastfeeding is also good for your health. It reduces risk of type 2 diabetes, breast cancer, ovarian cancer, and postpartum depression. And it also, lastly, a benefit for you is you miss less work. And this is because breastfed infants are not as likely to get sick as formula-fed infants, so you're not out taking care of baby instead of being at work after you deliver. Not only does breastfeeding benefit you and baby, it benefits society. It benefits society through saving money, there's less medical care costs, and there's fewer sick care visits. It's said that the United States could save over $13 billion if every mom breastfed. And this is because the medical costs would be lower and there would be fewer sick care visits, prescription, and hospitalizations needed. Also, as I said before, let moms miss less work who breastfeed, so it's a more productive workforce by you not having to miss work. And then it's also better for the environment because breastfeeding does not create the plastic and all the other things that you have to throw away for formula. So I'm going to move on to learning to breastfeed. You must remember that breastfeeding is a process that takes time and it takes practice, so we're going to get there. The first step of breastfeeding is bringing baby to breast, and this is important. So to do this, you want to have your baby only wearing a diaper because, like I said, promote that skin-to-skin contact. And you want to hold your baby against your chest up here, like so. So you want to put them upright with underneath your chin, and this will be comfortable for baby. You may want to put a blanket over the baby to help keep them warm and feel secure. When it's time to move him down to the breast, you want to support his head and neck with one hand and his hips with the other, and move him down towards the breast. This may lead to him making motions towards trying to find the breast. And then you should slightly tilt his head back, which allows easier swallowing and sucking. And you want to allow your breasts to hang naturally so that it's easier for them to find. Once they feel the breast on their cheek, they're going to open their mouth wide and reach up over the nipple. So at first, your baby's nose will be lined up opposite of the nipple. It's going to be lined up with the nipple opposite, but as the chin goes closer and he deepens his hold, it's not going to line up anymore for a deeper latch. So now I'm going to talk about latching on, because this is an important part. So latching on is defined as the proper attachment of the infant to the breast when feeding. So the most important thing I want you to take from this is that you should not experience pain while breastfeeding. As I said before, it should be comfortable and it can even make you feel great. So you want to have the infant's chest against your body so that they don't have to turn their head while they're feeding, because this is promoting them. So, and you also should see little to no areola, and this depends on the areola size and the baby's mouth size. So you want to see his mouth full of breast, and you will notice the tongue cupped under the breast, but you may not be able to see this because it's in his mouth. So, and you want to hear an audible swallow, and they may wiggle their ears as they suck, and then you want to see the baby's chin touch the breast. So as you can see here in this picture, he has a proper latch on. We can line him up. The chest is against the body. There's little to no areola seen. His mouth is full with his cheeks puffed out. I'm sure his tongue is cupped under, and then you want to see his chin is touching the breast right there. So we're going to move on to breastfeeding holds, and the first hold is the cradle hold, which is seen right here. This is an easy, and it's the most common one, and it's comfortable for most mom and babies, because like I said, you want to be comfortable. This is for you and baby. So you should hold the baby on the forearm like this, and his or her whole body facing yours, and then it's just the typical breastfeeding position. Next is the cross cradle hold, which is underneath right here. And this can be useful for premature babies or babies with a weak suck, because it provides extra head support. So you want to hold your baby along the opposite arm from your breast you're using, as seen here. She's using the opposite arm. And then you want to support the breast with the other hand, as she is here, to help facilitate the breast into the mouth. The next hold is the football hold, which is seen over here. And this is useful for mothers who have had C-sections or who have big breasts. This allows you to hold and better see the baby and control the baby's head. So what you want to do here is support the baby's head at the base of the neck, as you see her doing here, and then have him put back like you're holding a football. And then lastly is the sideline position, which is useful for moms who had C-sections also. And these is also good for a mom who wishes to get extra rest while the baby's feeding. So what you want to do is face the baby towards you on your side and pull him to your breast, as she has here. Now you don't want to fall asleep with the baby there, because that could be dangerous, but it's useful for moms who are tired. Now I'm going to talk about useful tips that will help promote a positive breastfeeding experience. You should breastfeed as soon as possible after birth. This creates no time for the baby to be fed formula or anything. And then also, if you wish, you can talk to a lactation consultant who can help you if you do experience some troubles throughout breastfeeding. And they can help you and inform you on many things. You also want to learn your baby's hunger signs, and these include the baby being more alert. They may stick their fists in their mouth or make sucking motions with their mouth. And when they do this, you want to offer baby breast, because it usually means that they're hungry. Follow your baby's lead. Once they're properly latched on, let them kind of do what they want to do, because they're trying to get comfortable just like you're comfortable. So they want to get what they want out of it also. And then keep your baby close to you. This is a new world to them, and they want to be close to their moms. So the closer you keep them to you, the better off they are, and the more likely they are to properly attach. avoid nipple confusion, so you should limit the use of pacifiers, bottles, and supplements. And then sleep safely and closely to the baby. You don't want to sleep with the baby in the bed because that, like I said before, that's dangerous. But you want to have his crib in your room beside your bed, because that way your breast milk is readily available right there. You can just get up and pick him up and feed him. And then know when to wake your baby. If it's been 4 hours since he's last eaten, you want to wake him up and feed him and go ahead and get him fed. And then in conclusion, breastfeeding is the #1 feeding option. And it promotes healthier babies and happier moms. And just remember, you can do it. I know it's tough, but you can do it. And you want to do it because it's good for you and baby. I provided a handout and a sheet of local support groups that you can attend if you're having issues. And always remember, as it says here, breastfeeding rocks. So, are there any questions?